Hi, I'm Jeff Hummel. I'm the Medical Director at Qualis Health for Healthcare Informatics. Oral health is a major unmet need. Oral health impacts patients' quality of life, their ability to find work, and it adds to the total cost of healthcare. At the same time, primary care has the skills to manage oral health. There's a proven action plan for integrating oral health into primary care. Let's see how one practice does it.
We serve a wide demographic of patients. We have a big population of private insurers, as well as Medicaid, state, and Medicare services also.
So integrating oral health care was a very exciting initiative for our practice to take on. It's very representative of the culture here at Sound Family Medicine. I like to think of our leadership and our providers as kind of cutting-edge innovators. We started with one provider team, and we've moved on. I believe we have close to 10 providers now that have adopted this workflow. We're very close to rolling it out organization-wide.
Some of the simple questions that we really capitalize on are, what kind of water source are you using? Are you getting fluoride? Are you having any symptoms such as pain, bleeding from your gums, dry mouth? And when have you seen your dentist? And some of those trigger a response. When we look in the mouth, we're looking for things such as cavities, exposed roots. Are they having spots of thinning of the enamel? Sometimes you can see that on exam if it's very obvious. To integrate oral health, it's actually been much easier than I initially perceived it. We have an excellent team of medical assistants that from the ground up, as soon as a patient hits a door, they're addressing these as part of their intake into the exam room.
Well, I feel like my role as the MA has been particularly important because we're the first line of screening to make sure that the oral health screening gets done. We have to ask all the questions, appropriate questionnaires, and dry mouth, bleeding. Ask them if they have any current cavities that they're aware of to make sure that that gets addressed at their office visit with the provider.
It's really important to make sure that you put tools in place for your providers to take on this additional work. That's one of the challenges in family practice, is that our providers are taking on more and more work, and there aren't any more hours in the day to do that. So providing tools to shorten those visits, to streamline those workflows is critical in this.
Having the medical records set up to do this made the work in the patient room very achievable.
Our data shows that we started out with a small percentage of our population at the beginning of the project, and as we adopted and more providers took on the workflow, we saw that trend increase steadily over time.
Since starting with the project, I have seen a tremendous change in working with my diabetic patients and actually realizing this is an important part of their care, getting them in to see their dentist, they're seeing benefits, and actually seeing that being a part of their care tells me that I'm doing a better job at encompassing their whole health as opposed to just their diabetes.
A lot of our patients, they've never been asked that question before, so it was kind of new to them, and then it really sparked the interest in them and saying, wow, I've never seen the dentist in the last year, so maybe I should go get this checked.
The learning curve, although it may feel a little different up front, is really something that hasn't affected my time with my patients in a negative way. In response to any colleagues that are interested in or maybe thinking about doing this, I would say that my transition from not doing it in a prior experience to doing it now at Sound Family Medicine has been a very easy transition. And I feel like the benefit is very rewarding, particularly influencing the futures of these patients. I think that the return on investment, so to speak, is phenomenal.
The framework for oral health integration that this group used was developed at Qualis Health and has been published as an implementation guide and tool set. These resources are available at no cost if your practice would like to try this.